Kumarswami College, Ausa, which is related to Swami Ramananda Tirtha Marathwada University, Nanded, welcomes heartily all the participants and dignitaries here on the virtual dais. The reason is the national webinar, which has been organized by the college, and this national webinar is the part of mini webinar series, which was started on the eve of the Women's International Day, and it is still going on. The webinar series has been organized to exchange knowledge, and the theme of the webinar series is empowerment of women. In the beginning of this national webinar, I heartily welcome the chairperson and chief organizer of this webinar series, Honorable Principal Dr. M. Bedkar sir, as the presiding authority. I am very happy to welcome today's honorable dignitary and keynote speaker, Dr. Vaidehi Pote ma'am, who is aesthetic medicine practitioner, cosmetologist, trichologist, and nutritionist from Kolhapur. Today, we all are very lucky to listen the keynote speech on the topic common skin and hair problems and care. Honorable speaker is going to enlighten us on the topic from all the angles. I heartily welcome you, ma'am, as the keynote speaker and chief guest for this national webinar. I also welcome the whole of organizing committee of this webinar series. And before the commencement of the actual speech, I would like to invite Dr. Anita Dhole ma'am for the introduction of the chief guest and keynote speaker. Please ma'am, welcome.
Thank you, sir. Good evening, everyone. You all are welcome to this webinar series organized by Shri Kumarswami College, Ausa. Firstly, I would like to thank respected principal and chief organizer, Dr. Bedkar MM, who has given this opportunity to introduce a resource person on this virtual platform. I am also thankful to respected Karad sir, IQAC coordinator, Dr. Kale sir, and all the respected participants, those are joining this webinar series. So, I am very happy to introduce today's keynote speaker, Honorable Dr. Vaidehi Pote ma'am, who is aesthetic medicine practitioner, cosmetologist, trichologist, and nutritionist from Kolhapur. Title of speech is Common Skin and Hair Problems and Care. Dr. Vaidehi ma'am is a dentist and medical cosmetologist, aesthetic medicine practitioner from she is related with UK and Germany also. She is a certified yoga trainer, face yoga expert, also runs Vedas Yoga, which takes online workshops for men and women. Also a member of NGO Hirkani, which works for rehabilitation of women and child. Recent achievements are Mrs. Glamour of India 2022 National Beauty Pageant, Mrs. Maharashtra 2022 State Level Beauty Pageant. She received India's Ideal Women Award of the Year 2022 in Fitness and Glamour category. She also got Bharat Ratna Dr. B.R. Ambedkar National Women's Excellence Award. Also worked as jury to Mrs. Miss Mr. India, Hirkani Mahotsav, Glamour, Style Icon, etc. She writes articles related yoga, one of which published in Yog Sugandha magazine of Yoga Vidya Dham Nashik. So with this introduction, I request today's keynote speaker, Honorable Dr. Vaidehi ma'am. Please start your speech. Thank you. Welcome, ma'am. Thank you so much for such a warm welcome. Am I audible?
Yes, ma'am. Yes.
Yes, ma'am. Yes.
Yes, thank you. Thank you so much for inviting me at this webinar. I will like to start my lecture. So my topic is basically common issues related skin and hair and how to take care of it. Actually, this topic is so much vast, so I am cutting it in very short. Okay. So first we'll discuss regarding the hair problems. In today's life, everyone seems to have a story when it comes to your hair and skin problems. No matter what your story is, the ultimate goal of everyone is healthy, great looking hair, healthy, gorgeous skin. So today, first we'll discuss here the 10 common problems of your hair and best way to overcome it. The first and most commonly problem of hair is dandruff. I think we all experience dandruff in a once of lifetime, surely. So you can correlate it with it. So dandruff is basically scaly particles that clings to the root of your hair and can be caused by your poor diet, infection, and or even your sluggish metabolism. So how you will fix it? So that is the one solution. You have to visit once you have a ruled out, you have a dandruff problem. You have to rule out with your medical issues with your doctor first. Then use a good quality of anti-dandruff shampoo and conditioner suggested by your medical practitioner. Then you can also take your advice of your salons or beauty professional that they also can recommend you the best products. And there are a lot of treatment modalities available to getting rid of your dandruff. The next most common topic is hair loss. Okay, although historically discussed problem of baldness among the men, hair loss thinning is also now a common problem with women also. For most of men, it may be the male pattern baldness, and for female hair loss, actually male and female hair loss, both hair loss can caused by stress, medication, changing in your hormones. For female, it's a menopause. For male, with the stress level, poor diet, and water. Additionally, many hairstyling products with the chemical and excessive heat can contribute to the hair loss. So how you can fix it, your hair loss problem? So first you have to visit the obviously visit the medical practitioner. They will rule out the grade of your hair loss baldness. So if you have just starting of your hair loss, it can be treated with normal medicines, that is such simple multivitamins tablet, shampoo, hair loss serums, which can repair your hair loss. And if you have more than that, you have to take some medical treatments like PRP. PRP is a plasma-rich platelets therapy, GFC, and low-level laser light therapy. And if your hair loss is much, which cannot be repaired or recovered by any of this treatment, you have to go for hair transplant surgery. Nowadays, hair transplant is also easy and a quick recovery, less painful, and you will get a quick results. Okay, quick natural hair. And if you don't want to go for surgeries, you can also opt for hair wigs, hair patches, And nowadays there is a one permanent makeup technique also that is known as scalp micropigmentation. Okay. So next problem is dry hair. So shampooing too often causes dry hair. Although sneaky clean hair is a good thing, many people will do overdo of shampoo. Sometimes they use the shampoo twice a day per day to strip away all their natural hair oil. So it will cause you excessive dryness that will lead to many other problems like a dandruff, split ends. How you can fix this problem? You can start using gentle shampoo which will stimulate oil glands. You have to stay washing your hair about every 3 days using an acidic shampoo with a pH between 5 to 6. Also try an overnight moisturizing conditioner and hot oil treatments which will help you to recover your dry hair. If you have any doubts or queries, you can ask me, okay? I'm just covering it a bit fast because this topic is too much vast. If I go with the one topic, it will take much time, okay? So my next one is the split ends problems, okay? What is the main reason for split ends? The overbrushing of your hair, excessive perming, too much of heat treatments, and lack of good conditioner can cause you split ends. So how you can recover your split ends? There is no other option to recover your split ends back. There's only one option. You have to get a professional to trim to your split ends and make sure you can change your hair care routine to provide it with a moisturizer. Then next is the oily, greasy hairs. The oily hair is caused due to scalp produces too much of natural oil that is known as a sebum. Sebum is produced by natural sebaceous gland, which can sometimes work over time. Okay, the resulting in excessive amount of oil. So how you can fix this natural greasy hairs? You have to use try a shampoo that is specifically being formulated to control your sebum. Okay. Then next hair problem is mostly frizzy hairs. So frizzy hairs occurs when the hair's moisturizer level falls down below your normal levels, and it can also be a hereditary problem. Okay. So how you can fix the frizzy hair? So you have to firstly use a shampoo conditioner specifically designed for the frizzy hair. Talk to professional for your specific product suggestion. You may also want to consider a mild relaxer to keep the freezers at a bay. You can try leave-in conditioners also, which are nowadays easily available in the market. The next problem is the dull hair. So there are many causes of dull looking hair: chemical, heat styling damage, environmental causes. So how you can fix your dull hair? So first of all, you have to try the moisturizing shampoo and try to cool rinse. Okay, you have to use either lukewarm water or cold water for your hair rinse, so you can prevent the dull looking hair. The cold water causes the hair shaft to contract, which leaves hair looking smoother and shinier. Okay. And the next, nowadays I'm seeing the problems with the patient, that is the heat damaged hair. Nowadays people are very obsessed with the heat treatments like the straightening, smoothing, Botox, keratin, neoplasty. There are nowadays lot of chemicals and heat treatments are coming regularly, and people are using that, which causing them a lot of problems. Like so how you will fix that problems? First, you will need to lay off the hot irons as much as possible. Okay, with our today's lifestyle, we cannot maintain the such a things. If we want to keep all natural hairstyles, it's not possible. We have to attain many functions, or we have to go out and we have to look groomed. So we are using this hot tools. So try to avoid it as much as possible. And whenever you are using these hot tools, make sure you can apply the heat protectors first and then apply your hot styling products. The next problem nowadays we are seeing is the color damage hair. Now people are doing the highlights, ombre, and to cover the gray hair also. When you color your hair, chemical are used to open your hair shafts, leaving your hair extremely porous and prone to brittleness and the breakage. How you can fix it? Try to color your hair with a professional and use a dye with a specific moisturizers and get a pre-color cream because your ends are prone to soak up excessive colors. So first trim your hairs and then color, and try to avoid ammonia. Okay, try to use ammonia-free products for your color. And the next, I think, is the gray hair. Too many gray hair is a badge of honor, but other would prefer it to get rid of it because gray hair can be the brittle, more unruly than other strands. And nowadays, okay, the small kids from age of 7 to 8 years are. I'm seeing the patients of 7, 8 years also having the gray hair. So it's a basically due to nutritional problem. So if you fix nutrition, you can get rid of your gray hair. After 30 or 35 years, gray hair is a common thing. Okay, you cannot avoid it. It's a normal, natural aging process. So you just have to color it or plant it as it is. You have these two options. Okay. Although hair issues are certainly vary from person to person, by following these simple steps, the common problem are easily repairable. These common problems of the hair problems will soon be a thing of past, and you will be on your way to great head of hair before you know it. Okay, if you are busy, don't have a time. If you're busy and don't have time, you can always visit your medical professional and beauty professionals to get a treatments done. I will tell you simple few steps which will help you to get a skin and hair problem solution. The first thing, firstly, focus on your diet. If you keep eating healthy and nutrition diets, your 50% problem will be solved. And try to protect your hair and skin from sun and excessive dirt. Okay, try to avoid it. If you have to go out during the sunny time, just cover your hair and cover your skin. Just physical covering will reduce the damage of your hair and skin also. And first and mostly do exercise. Okay, exercise will help you to get rid of lot of problems, like your metabolic issues will get rid of due to exercise. And nowadays mental stress is the biggest problem, so you have to start doing meditations. There is no other options to avoid your mental stress, because in today's era we are facing lot of stress due to our work which we cannot avoid. So it's better you start doing meditation. It will help you to get rid of your stress. Okay, so I think this is the most common hair problem. So if you have any doubts in hair, you can ask me.
They will discuss at the end, madam. You can continue up to your time.
Okay, no problems. Okay, so I feel this is the more common problem, so I discuss this with you. So we'll start with the skin now. So for a skin, first and most I feel all skin problems are majorly due to allergies, some irritants, some genetic inheritatory, or due to wrong makeup products, certain diseases or immune system problems can cause skin conditions. So we'll discuss some common conditions. The first one is acne. or pimples. This is the we can say what is the acne. It is basically caused when blocked skin follicle from a plug caused by oil from your glands and bacteria and dead cell clumps together and swell. We can see the acne problem is from a teenage. Okay. So teenagers acne problem is a common thing. We can solve this acne with the proper medication that has the topical ointment. If topical ointment didn't work in any cases, we start using oral medication, and we have to give them some treatments like some chemical peels, laser light therapies. Okay, some lasers are also meant to do acne reduction, and after once you get rid of acne, there is a lot of problems in with acne scars, because some people are really tend to, if you got one acne, they will tend to get pop up, so it leads to acne scars. So scars and marks reduction is the another treatment, and you if topical medication didn't work, we have to go for CO2 lasers and more higher modality of treatment such as the lasers. Some steroids can be used to treat such a stubborn acne and acne marks. The next common problem nowadays I'm seeing skin is the pigmentation uh, or melasma. Melasma is basically, in Marathi we can say this वांग किंवा चट्टे जे असे बटरफ्लाय रॅश असते किंवा चट्टे पडलेले असतात. That is the common problem in nowadays. So it is basically due to the UV lights. We didn't use the proper sun protection, so we got this melasma or pigmentation of skin. So first, to treat melasma, the first is prevention is better than cure. If you use proper sun protection, melasma didn't happen. And if it happened to you, it's a very hard to get rid of them. With the medications, we can fade it, but it will take a more and more time. So it's a better recommended to you get a sun protection. So it will help you to get the glowing skin instead of treating and using so much of products on your pigmented area. Okay. The next, I feel the most problem in India is the dermatitis, which is the skin disease causing you itchiness, that and you scratching leads to the redness, swelling, cracking, and getting your clear fluid, crusting and scaling, which is basically caused due to some allergies and irritants, which you can get rid of with your medications. And the mostly psoriasis also seen nowadays. Psoriasis is a very hard to get rid of, and psoriasis, the basic factor is the unknown. It's mostly due to your stress level. So you have to take the stronger medications like steroid to treat your psoriasis. And one common is vitiligo. Vitiligo is a disorder that causes patches of your skin, which is to become a white. It happens due to cell that make color of your skin is destroyed. It's a due to destruction of melanocytes. It happens. Vitiligo is a mostly genetic skin disease. You cannot treat vitiligo. You just can camouflage your patches with the permanent makeup techniques and other now difficult different modalities of treating. Okay, and next I think is the dull looking skin problem. So dull looking skin is basically due to you do not take care of your nutrition, that is basically your diet, and your skincare routine is poor, which will lead to dull skin. Okay, I believe what you eat that reflects on your skin and hair. So in skin and hair problem, basically first focus on your diet and workout. it will solve your 60 to 70% problem. And next is your skin care routine and the hair care routine. Try to keep simple so you can follow it with easily. First, I have to suggest you few simple tips. Firstly, try to drink minimum 10 to 12 glass of water daily. It will help you to keep your skin glowing, as well as it will useful for your hair also. Then second is sun protection. Try to use minimum 50 SPF sunscreen in any season. All seasons after your bath, please apply sunscreen, so you will not face the problems like pigmentation, dull skin, and the tan of skin. Okay, you can avoid it with your sunscreen. And next is focus on nutrition diet, which you get locally. Please eat that. Nowadays, I'm seeing, being a nutrition, I'm seeing the people are more focusing on the Western diets. Like for a breakfast, they want to eat avocado toast or something like yogurt, and they, you can say they degrade our local foods like parathas, pohas, idlis. This is also nutritional, and we are eating it through our generation. So it's a better to eat our local food. It will get easily absorbed, and it will really help to get our all problems solved. So try to eat local foods. Okay, don't go for the fancy foods. And then next is please include nuts in your diet. If you are Maharashtrian, you can use the groundnuts, almonds, and if you are South Indian, coconut, cashew nut. Please try to eat this local Indian nuts in your diet, which will take care of your oils and good fats in your diet. Okay? And being Maharashtrian, you can add that Javas in your diet, which is a very good source of omega-3 fatty acids. And if it's not available to you, you can go for the fish. Fish is also a good source of omega-3. Okay. So my basic note to all, just focus on your grandma's recipes. Don't go with your fancy foods item. And try to keep your lifestyle as simple, which will help you to follow it regularly, and you will see the odd results. So thank you so much. I would like to listen from you. If you have any doubts or queries, we'll discuss on that.
Thank you, ma'am, for your very good speech on the topic, problems of hair, skin, and its care. Now, after this very good presentation, I would like to invite participants if they have any query, doubts, or want to discuss. Please, participants.
Good evening, madam.
Good evening.
Badiuddin Ahmad from Hyderabad.
Yes.
Madam, my two nieces are having the problem of hair falling. I have shown her with the different skin specialists in Hyderabad, but still they are studying actually. They are to graduation course, but with a great speed, their hair is getting falling, and they are worried. One is about 21 years of age, another is around 19 years of age, and they are using different oils and the doctor prescribed, but somehow unable to overcome the problem. What is your suggestion to them?
First, the age is 21 years, so basically either it's due to genetics or some hormonal changes. First, you have to rule out with a blood test what deficiency it's causing, because there are a lot of problem of hair loss. And then oil. I didn't suggest you any oil. I will recommend some serums which contains redensil or minoxidil, which will help to regrow your hair. And if this doesn't work, you have to go for medical treatments such as some PRP treatments, GFC treatments, low-level laser light therapies. And along with all this, you have to use a proper shampoo and the multivitamin tablets.
Okay. Doctor has written some different soaps and different shampoos, very costly skin this medicine. And both my nieces have undergone some medical thyroid test, something that they have gone. All tests have come normal, madam. So still,
Okay.
I don't know what is. They have asked some history also regarding my sister-in-law, everything from father side and father something. Doctor is very senior, Dr. Balaji in Hyderabad, at Vaidehi Pote area. And I don't know, still they are, because they are about to get married, and my both brother and my sister-in-law are married. So today I'm getting the right person to get some clues on what to do actually.
Yes. If possible, I will share my number. We'll do a conference call or video consultation. So I will get a rule out. Which is
I take number with Petka sir. I'll ask both the manis to talk to you and get all the information. So thank you so much, madam.
yes, sure. Thank you.
Thank you, sir. Is there anybody having any doubt or question, please?
Good evening, ma'am.
Good evening.
I have one question.
Yes.
One of my friend is suffering from vitiligo skin disease. Is there any effective treatment available nowadays?
For vitiligo, there is no any perfect treatment available. You can just camouflage that vitiligo patches.
Okay.
Just you can cover that white patches, and you can take some medication and you have to follow some rules to restrict that vitiligo, but you cannot cover it totally.
Right. Okay, thank you, ma'am.
Hello. Good evening, madam.
Training.
Yes, madam. You explain very nicely. Most of the time, these are the common problems. Hairs or skins like that. I heard that the people's, basically women's, when they transfer from one place to another place. So what happens if the water is changed? They sometimes say that because of changing the water, my skin become changed or some hair doubts. Now, whether the effect of this water or not, please.
Actually, I also treat a lot of students which is shifted from one place to another place for education, and they are facing the same problem. But in my opinion, water is contributing only 20 to 30%. Mostly what happens when you shift from one place to another place, your lifestyle or your routine, your eating habits, your nutrition, everything is changed. So it's a combined effect of weather, water, your hormonal changes, your stress level also get increases because you are shifting to new place, and you have to try to accommodate with that place. You have to do lot of things. You are doing shifting. You are new to that place, so you are trying to accommodate with the people. You are making a new friends. That all stress level also increase the skin and hair problem.
Okay, ma'am.
If you are using normal water at your native place, and if you are shifted to some place where is the hard water is there is no water softening, that will also triggers your hair fall.
Okay, madam, of course. But many times we hear these things, from women's basically. We change this place, and that is why my hairs have become less.
Yes, that happens.
So,
Combined effect.
yes. Thank you very much, ma'am.
Thank you.
What about the reasons of psoriasis becoming very common in Hyderabad city? Many youngsters and also the old people are getting psoriasis problem. In that rate of that disease has increased a lot in Hyderabad. What could be the basic reason for that, madam? And how can we protect from that?
So that nowadays I'm also seeing a lot of psoriasis patients. The basic reason is the mental stress. You have to decrease your mental stress. In nowadays we cannot say the patient ki avoid mental stress. It's a part of our life, so we can do it, just decrease it by doing some meditation or join some hobbies like that.
Because of allergic, something like that? Is it because of this atmospheric environmental changes or something on this thing?
These are there. These are contributing factors to psoriasis. That is your atmosphere or increase of pollutants or some irritants in air. But the main basic problem is your mental stress.
देर इज क्वेश्चन इन चैट बॉक्स, यदि थायराइड के कारण बाल कम हो गए हैं तो उसके लिए क्या किया जाए?
First you have to start your thyroid level. आपको कंट्रोल में थायराइड लाना पड़ेगा, and with that also you can start some treatments for your hair loss. But जब तक आपका थायराइड लेवल कंट्रोल में नहीं आता है, वो हेयर लॉस स्टॉप नहीं होता है. So first focus to try to maintain your thyroid level as much as normal with the medication.
I think the thyroid is not only contributing the hair falling, but it leads to the diabetic, it leads to many other diseases.
Yes. And it's necessary to maintain it. अगर आपको मेडिसिन लेने पड़ रहा है तो भी आप मेडिसिन लो और उसको मेंटेन करो. बिकॉज इन इंडिया देयर इज टेंडेंसी कि मैं वो नेचुरली कर लूंगी, मेडिसिन नहीं चाहिए. बट in some cases you have to take, there is a no natural options. मतलब natural options होते हैं, but we cannot guarantee, being an allopathy doctor, we cannot guarantee that natural products कि कब तक वो काम करेंगे कि नहीं करेंगे. We cannot say it exactly. So these medications are recommended because we can say कि इतने आप अगर ये टैबलेट्स ले रहे हो तो इतने में आपका इतना थायराइड कम होगा या फिर नॉर्मल लेवल तक आ जाएगा. With natural solutions we cannot say exactly. So take a medications and आपकी थायराइड लेवल आप नॉर्मल करने की कोशिश करो. स्किन डिजीज का कारण yes, आनुवंशिकता yes, skin disease is due to genetics also. Vitiligo is the main due to genetics. और अगर आपके जीन्स में है हेयर लॉस, अगर आपके पेरेंट्स को बाल्डनेस की प्रॉब्लम है तो आपको वो भी स्किन एंड हेयर प्रॉब्लम्स जेनेटिक आ सकते हैं और आते ही है. इफ यू सी अगर किसी के पेरेंट्स को बाल्डनेस है या फिर वो गंजे है, देन मे बी आपके जो फर्दर जनरेशन है उनको 10 to 20 years पहले ही वो प्रॉब्लम आजकल वो लोग फेस कर रहे हैं. Any other doubts?
Ma'am, I just wanted to ask one question, that how safe is peeling on the face? Secondly, what would you recommend for the gray hair?
Gray
And
hair.
my third
Age,
question, tell me.
for gray hair, age?
33.
Okay. Okay, and third question?
Means if we do facial once in a month, is that okay, safe or not?
Okay. The first one, peeling is a safe procedure. We are using peels for many things. Just I will suggest you, when you are trying peeling, don't do at salon. Nowadays, salon people also start doing peelings. Please do peeling with the proper medical professional. So you will get safe and proper result. And second, graying of hair at the age of 33 is a normal. Okay. So don't worry about it because if I started you some nutritional tablets, you will see the results only 3 to 6 months. So it's a natural procedure. Don't do anything at the age of 33. Just you can camouflage it. Okay. And third question.
Facial.
Facial.
Once in a month,
Yes.
yeah.
Once in a month. Yes, you can do facial once in a month. It's okay.
Okay, yeah, madam. Thank you so much. So peel is safe, means actually what had happened, I had done my peeling, but after peeling, many pimples started coming in.
Okay.
So was there anything went wrong?
So basically, which peel you did?
It was fruit peel, means what doctor had thrown. She is BHMS doctor, and she also has done this course. So means I did it first 3 sittings. It was very good result, but after that, I don't know. Suddenly, I started getting these thing pimples,
Mm-hmm.
and it didn't stop only. So I stopped that peeling only.
Okay.
So what was the reason actually?
Anything changed during that thing, like your diet, your location,
No, nothing.
or your skincare products?
Whatever she recommended me, I used to use that only.
Okay. So mostly peeling will not cause you this acne. Maybe have some products, skincare products.
Oh,
Yes. उसपे there's something wrong which in your skincare products.
okay. So can I contact you regarding this? Means
Yes, sure.
okay, fine, man.
Because I have to take your all.
Right. You need
It
to
will
see.
not look good on present. I mean, lecture. So
Yeah,
you contact me personally.
Yeah, I'll contact you for this.
डॉक्टर वैद्य मैडम पहले जमाने में सिर्फ हल्दी लगाते थे ना, मैंने कहा थे ट्यूब से, ये जो आजकल जो नए नए क्रीम्स आ गए हैं, ये शायद इसको और कंट्रीब्यूट कर रहे हैं हमारी खूबसूरती में, बिगाड़ पैदा करने, निखार ने बिगाड़ पैदा कर दे रहे। वो जो एडवर्टाइज देख के लगा रहे हैं फेयर एंड लवली समथिंग ऐसा तरह तो मतलब वो पहले सिर्फ हल्दी लगाते थे बड़े लोग। मैं भी 57 इयर्स का हूँ, मैं मेरी दादी, मेरी नानी भी, मेरे बड़ी खाला को तो वो लोग हल्दी लगाते थे कुछ कहीं जाना तो, and that give them a lot of very bright effect on their faces. अभी कोई हल्दी को हाथ में लगा
सही बोला।
Actually, जो भी older generations थे वो बहुत होशियार थे। आजकल के लोगों की तरह नहीं है। लोगों को you can say रेडीमेड सब कुछ चाहिए होता था। If you see your grandmoms और जो भी दादी नानियां है, हम लोग आजकल लैक्टिक पील करते हैं। वो लोग दही योगर्ट अप्लाई करते थे स्किन पे, हनी अप्लाई करते थे, विच इज नेचुरल ह्यूमेक्टेंट, जो आपकी स्किन को रिपेयर करता है, मॉइस्चराइज करता है, ग्लो देता है। अगर टैन है तो वो टोमेटो प्यूरी अप्लाई करते, ये जो भी वो लोग अप्लाई करते थे इट्स बेसिकली एसिड्स। और आजकल क्या होता है कि दिस एसिड्स को डिराइव करके हम लोग उसका पील बनाते हैं, एंड वी यूज पील ऑफ दैट्स फ्रूट्स एंड एवरीथिंग। और अगर आप देखोगे आजकल रेटिनॉल्स की क्रीम भी यूज करते हैं टू गेट रीड ऑफ रिंकल्स, बट जो नानिया थी वो आप एक बक्शुअल करके ऑयल आता है विच इज अ नेचुरल रेटिनॉल, वो लोग वो यूज करते थे स्किन पे। तो वो उनको एक्चुअली पता था कि कौन से इसमें क्या है और वो किस तरह अपने स्किन पे काम करेगा। आजकल इतना नॉलेज नहीं है लोगों के पास।
क्यों आप जैसे डॉक्टर लोग इसको क्यों रेफर नहीं करते हैं? क्यों आप लोग खुद लिखते हैं क्रीम वगैरह साबुन अगर दोबारा अगर आप ट्रेडिशनल वे में जाकर यूजिंग टर्मरिक रिलेटेड आइटम्स जैसे आपने बताया,
नहीं लोग नहीं सुनते हैं क्योंकि बिकॉज आई एम अ योगा ट्रेनर आल्सो, आई रिकमेंड फेस योगा इंस्टेड ऑफ डूइंग बोटॉक्स एंड फिलर्स। बट जो भी पेशेंट मेरे पास आते हैं उनका ये होता है कि मैम फेस योगा करके, आई से फेस योगा इज द क्विकेस्ट रिजल्टिंग ब्रांड। आपको 10 दिन में रिजल्ट दिखेंगे, बट लोगों को 10 दिन यूज नहीं करना। First you do botox and will get the results in one, मतलब उनको फास्ट रिजल्ट्स चाहिए होता है और उनको 100% गारंटी चाहिए होती है। उनको ऐसे नहीं है कि योगा किया डाइट और हेल्दी करना है, ये नहीं।
इंस्टेंट ब्यूटी
चाहिए।
थैंक यू सर।
बराबर है बदिउद्दीन सर, यू आर राइट, यू नो। क्योंकि नई नई कंपनियां भी मार्केट में आ रही है, नए नए प्रोडक्ट्स लॉन्च हो रहे हैं। जो पुरानी वाली एक क्रीम थी, शायद मैं थोड़ा शेयर कर रहा हूँ, वो भी टर्मरिक क्रीम पुस्तकी थी, उसकी तो एडवर्टाइज भी बंद हो गई अभी फिलहाल।
एक जमाने में पॉन्ड्स का इस्तेमाल था, पॉन्ड्स का पाउडर कई जमाने तक मिलता था। मेरी अम्मी 82 इयर्स की थी, उनके पास पिंक कलर के पॉन्ड्स के व्हाइट पॉन्ड्स का क्रीम आता था, पाउडर का डब्बा छोटा बस भाई। आजकल देखो तो पूरा बॉक्स कर रहा है, बॉक्स कर रहा पूरा।
आजकल लोग यूज ही नहीं करते। अगर मैंने कितने ऐसे पेशेंट्स हैं जिनके मैंने प्रोडक्ट्स उठा के फेंक दिए कि इतना मत यूज करो, ओवर प्रोडक्ट्स भी लोग आजकल यूज कर रहे हैं एडवर्टाइज देख के, या फिर यूट्यूब पे किसी एक्टर एक्ट्रेस का स्किन केयर रूटीन देख के वो लोग सेम फॉलो कर रहे हैं। जिस स्किन को उनकी जरूरत नहीं है वो भी वो लोग सब कर रहे हैं। लाइक कोरियन रूटीन लोगों में बहुत फेमस होगा, डबल क्लींजिंग, ट्रिपल क्लींजिंग. वी आर लिविंग इन इंडिया, वी डोंट नीड दैट मच थिंग्स. फिर भी वो लोग कर रहे हैं किसी और का देख के कि उनकी स्किन इतनी अच्छी कैसी है. अल्टीमेटली स्किन ईच कंट्री के वेदर पे, खाने पे भी डिपेंड होती है.
You are right.
But due to YouTube's and all, everything is comparing and start following blindly.
वही हर कोई हीरोइन बनना चाह रहा, तो उसमें क्या हो जा रहा, वो कब्बा हंस की चाल डाल रहे, अपनी चाल भूल के जैसा हो जा रहा.
Yes, surely. Or meditation, if you see, I have a few clients from other countries. They are preferring meditations and face yoga. और जो Indian clients है वो नहीं, मैं उनको फ्री में भी वीडियोस प्रोवाइड करी, वो लोग नहीं चाहते. वो दे आर सेइंग आप बोटॉक्स करो, फीलर्स करो, या फिर आप मुझे अदर कंट्री के डॉक्टर का नंबर रेकमेंड करो जहाँ पे जाके मैं ये सब ट्रीटमेंट्स करवा सकती हूँ. So it's nothing in the hand of doctors. जो patients चाहते हैं वो हम लोगों को करना पड़ता है, because it's our profession. We cannot say no at our clinic.
अलग अलग डॉक्टर के पास अगर अप्रोच हो गए तो अलग अलग स्कीम देता है, तो ये भी कुछ यानी कैसे विश्वास करना, ये भी एक बहुत समस्या है लोगों के सामने.
Yes, because it happens क्योंकि क्या हो रहा है कि आजकल स्किन एंड हेयर इंडस्ट्री इज ग्रोइंग. तो एक तो बेसिक डॉक्टर्स के पास कम नॉलेज होता है, या फिर उनको प्रोडक्ट नॉलेज कम होता है. उनको कोई ना कोई एमआरआई के टीचर्स आप ये यूज करोगे तो ये होता है, तो वो लोग वो भी देते हैं. एंड इफ यू गो विद द प्रॉपर नॉलेज, तो कोई पर्सन आपको स्पेसिफिक ब्रांड रिकमेंड नहीं करेगा, वो आपको स्पेसिफिक इंग्रेडिएंट्स डॉक्टर्स रिकमेंड करते हैं.
Yes, ma'am. Thank you very much. Thank you.
Ma'am, I have a question.
Yes.
Good evening, ma'am. Actually, ma'am, due to age or I don't know, but my skin is becoming too loose. And what would you suggest for skin tightening? Like whatever is easily available in households.
For skin tightening, first you have to start doing face yoga. And firstly, you are using skin protection. Any sunscreen?
No, ma'am. Lakme peach milk with SPF 15. That only I'm using. I'm not using much like cosmetics or skincare products.
That one doesn't work. Lakme peach milk 15. You are living in India, so you have to use a sunscreen with at least 50 SPF. So
Okay.
switch with sunscreen. You are applying Lakme, it's okay. But before that, you have to apply sunscreen. Or after
Okay.
that, you have to apply sunscreen compulsory. It will reduce your problem to 30 to 40%. And you can contact me personally, so I will see and recommend you. And make sure your water intake is enough, and you are eating proper nutrition.
Okay, anything that is easily available in households that can be applied as you have suggested, like some ingredients which are easily available at homes, and we can apply that. So anything as such?
For application, I have to know your skin type. If possible, just share me your
Dry skin I have.
please contact me. So I have to
Yes,
take your all
yes,
decisions, suggest you accordingly. Because what happens if I suggest you, you apply this, and you apply that, and if you got acne or any other problems, it will very tedious job to reduce that. So
Okay, fine. Thank you.
But when we apply sunscreen, how long it works? Means a whole day it works or some hours it
No.
works?
it will hour only 3 to 4.
3 to 4
You have to reapply it, and you have to at least use one finger of sunscreen. In India, I saw the people only take sunscreen, apply it very small, and cover it. It will doesn't work.
Okay. So 3 to 4 hours, and then we have to reapply
Yes.
it. Okay,
Yes.
thank you.
And quantity also, minimum one finger or one spoon.
Means it should cover entire face. It shouldn't be like,
Yes.
some patches are covered.
Yes, yes.
Okay, fine.
नमस्ते मैडम. मेरा एक सवाल तो यह है, जो छोटे बच्चों के सफेद बाल हो जाते हैं बहुत ही कम उम्र में हो जाते हैं, क्या वे ठीक हो सकते हैं और कितने समय में? दूसरा सवाल ये है कि जो हमारे सफेद बाल रहते हैं, हम एक तो सैलून पे जाके कलर लगवाते हैं और दूसरा हम मेहंदी लगवाते हैं, तो ये कितने समय तक प्रयोग करें कि जिससे बालों पर बाल ना टूटे? ये दो सवाल है।
ओके, छोटे बच्चों के लिए आपको न्यूट्रिशनल कमी की वजह से होता है सफेद बाल। फॉर दैट यू हैव टू टेक 3 months आपको टैबलेट्स लेने पड़ते हैं टू कवर योर न्यूट्रिशनल डेफिशिएंसी। एक बार वो न्यूट्रिशनल डेफिशिएंसी क्योर हो जाए फिर उनके बाल नॉर्मली ब्लैक होना चालू हो जाते हैं। एंड फॉर एल्डर्स आपको कलर अप्लाई करना ही पड़ता है। आई विल सजेस्ट यू, मेहंदी आजकल बहुत मतलब उनमें केमिकल्स होते हैं, मिक्सिंग होते हैं, इट्स बेटर आप कलर यूज करो जो अमोनिया फ्री है। आजकल अमोनिया फ्री, सल्फेक्टेंट फ्री कलर्स आ रहे हैं, आप वो यूज करो। और कब तक यूज करना है वो आपके ऊपर है। जब तक आपको ग्रे हेयर नहीं दिखाना है आपको वो यूज करना ही पड़ेगा और ना टूटे, इसलिए आप प्रॉपर हेयर केयर रूटीन फॉलो कर सकते हो। जैसे कि आप जब भी कलर कर रहे हो उसके पहले आप ट्रिम करो, बिकॉज अगर आपके एंड्स ड्राई है तो कलर ज्यादा सोक हो जाता है। तो आप पहले हेयर कट करो, देन यू अप्लाई कलर एंड यूज अ प्रॉपर शैम्पू विच विल गिव यू मॉइस्चराइजर, सो आपके बाल टूटेंगे नहीं।
मैम ये जैसे छोटे बच्चों को कहते हैं कि इसको सफेद बाल हो रहे, नजले की बीमारी है, नजले की, क्या वो सच में होती है?
नजले की
मतलब सांस की बीमारी? हाँ जी, कोल्ड।
क्या? कोल्ड? ओके, नहीं मुझे ये आइडिया नहीं है। आई गेस मेरे हिसाब से इट्स अ न्यूट्रिशनल डेफिशिएंसी।
मैडम तो सर के बाल को पहले जमाने में रीठा लगाते थे। रीठा को जो है गर्म पानी मार के वो दैट वुड हैव बीन रीठे का, तो बाद में शैम्पू भी आया था लेकिन बंद हो गया है। रीठा बहुत
रीठा इज अ वेरी नाइस थिंग। रीठा प्रॉपर क्लींजिंग है, तो आप रीठा भी यूज कर सकते हो।
जी जी, मगर आजकल इस्तेमाल में नहीं, कम हो गया उसका। शैम्पूस की इंट्रोडक्शन के बाद वो कमी हो गया है।
आजकल इतना लोग नहीं, मतलब वो सोप करके यूज करना पड़ता है ना।
मतलब इंसान, I mean, people have become so slave to the everything, or they are dependent on the everything ready made food, even food, everything. सारे पता है कि जंक फूड वगैरह के भी इतने आदि हो गए, इसको वो भी एक रीजन है कंट्रीब्यूट कर रहा हूँ ना बालों के कितने में या बालों के सफेद होने में। Because what type of oil is available, what type of food is available in the market, in the hotels, we consume it and automatically the effect will be even on our hairs also. कितना कलर लगाए भी तो कलर 15 days 20 days तक again you have to apply. Is a additional expenditure.
Yes, yes. It's our lifestyle changes which causing hole to our pockets. We cannot. मतलब हर एक इंसान की चॉइस है, उनको कितना स्पेंड करना है, किस हिसाब से रहना है।
Yeah, should not have a problem with gray hair, white hair. I think अभी एक उम्र के बाद सब मैं 56, मैं hair almost white हो रहा है, तो why should I apply? Old man, I must look like old man. Why should I become young?
Ma'am, I'm having one question that whether you can suggest any treatment for the split-ended hairs.
For split ends, there's a no treatment. You just have to go at salon and trim it. And after your trimming, make sure you are using a shampoo with a proper moisturizer. Try to avoid excessive brushing of your hair. And eat proper, increase protein in your diet. Make sure your water intake is also enough. Once you get a split ends, there is no other options than trimming.
Is there anybody else? Any more doubt, any more question, please?
I think everybody has covered, sir. Thank you so much, sir.
Very good keynote speech, and after that, very fruitful discussion. And Dr. Badiuddin sir, Dr. K.N. Kadam sir, Javir sir, Manisha ma'am, Manju ma'am, Dr. Vinod sir, Ugadi sir, and many other participants have asked the questions through chat box and got very satisfactory answers for skin care and for hair care. After this keynote speech, very useful, and discussion very fruitful, I would like to invite Chief Organizer and Chairperson of this national webinar, Honorable Principal Dr. M. Ambedkar sir, for his concluding speech. Please, sir, welcome.
Thank you, Professor Karad sir, and today's resource person, Dr. Vaidehi Pote madam, all the organizing committee members, Dr. Anita Dhule madam, Prashant Ogade sir, Professor K.N. Kadam sir, Dr. Baduddin sir, Zahir Ahmed sir, Javir sir, Baduddin Ahmed sir, all the participants, those who are joined here, Dr. Mangire sir, Dr. Jamutra Kadam sir, who is from my staff member, and all the daily participants, those who are joined here. This is the ending of tomorrow. This International Women's Day will end, and in this 14 speeches, most speeches were on the educational field, informative, but today's speech was related to health. Means along with knowledge, we should take care of our health, and especially for Women's Day, what are the problems of the skin problems, hair problems? These are mostly related with the women because they are taking care of that. And for that, we invited Dr. Vaidehi Pote madam, who is medical cosmetologist, also attached with the number of NGOs like Hirkani, and she is the Mrs. Glamour of India 2022 National Beauty Pageant, Mrs. Maharashtra 2022 State Level Beauty Pageant, and also the yoga expert. And she is not appearing first time here, but I think she's the third time she's helped us, contributed us on this webinar, and she is also related to so many social works, and she is also jury of the like these competitions, and she just accepted our invitation, and she give speech from her dispensary, I think. So it's like a doctor at your door. This and all resource, all the participants have taken benefit, discussed their problems, and she gave Indian therapy mostly recommended. Don't use highly chemicals, use Indian products or Indian therapies which is coming from our early generation. Thank you, madam, for contributing here for a best topic, which is useful topic related not only male but also women and men also. So thank you for your time for giving here with our webinar. Thank you, madam.
Thank you, sir. Now, vote of thanks. I would like to thank, first of all, the chief guest and keynote speaker, Honorable Dr. Vaidehi ma'am, who had accepted the invitation and graced us with a very useful lecture on the topic skin care and hair care. And we came to know about how the problems can be lessened through exercise, through nutrition, and through medication, and through yoga. So we got very significant information through the speech of the keynote speaker. So on behalf of the organizing committee of this webinar series, I am very thankful and grateful to you, ma'am. I also wish to thank the chairman and presiding authority of this webinar series, Honorable Principal Dr. M. Ambedkar sir. As it has been said that this webinar series included this series and previous webinar series from the bottom of the sea up to the space. And this particular speech was about health in general and about skin and hair in particular, which will be really beneficial, and it has become true because of the chief organizer of this webinar series. So I thank you, sir. I also thank all the participants for their contribution, punctual joining, asking doubts, raising questions, putting opinions and their views to make this webinar series very successful. So thank you, participants. I also thank the whole of organizing committee who is making lot of attempts to make this series successful, and they are trying to offer variety of topics so that audience can get knowledge about various subjects. So thank you, the whole of organizing committee. I also thank Dr. Anita Dhole ma'am for giving introduction every day of keynote speakers and chief guests. Finally, I would like to request participants, please fill the feedback link so that you can have your certificate.
Sir,
Thanks to all. Thank you.
sir, those who want to contact with Dr. Vaidehi Pote madam, I have sent my number in the chat box, so they can note. I will give you the number which they will want to discuss with the today's resource person.
I would like to inform participants that the number of Dr. Vaidehi ma'am has been posted in the chat box. Those who want to contact, please have it. Thank you very much.
No, sir, it's my number. Those who are interested, I will give number if they contact to me. Okay, sir.
Phone number of the chief organizer, Honorable Principal Dr. Ambedkar sir. You can get ma'am's number through the chief organizer. Thanks.